how do I know when to be worried about my child? How do I know when it's just, he doesn't want to go to school. She doesn't want to go to school because she doesn't like school.
How does one assess if their educational leader that's giving them advice with regard to mental health issues knows what they're talking about or not?
Welcome to the Learning Curve podcast, brought to you by Mishpacha magazine.
We're raising children in a changing and challenging world.
So let's tackle the important issues facing frum families today.
I'm Rabbi Garfield, Manal of Yeshiva Torah MS in Houston, and I love talking about chinuch.
I'm Rabbi Ari Schonfeld, Manal Yeshiva Katana of Manhattan, director of Camp Aish. I also love talking chinuch and sometimes fishing.
Join us as we answer your questions and discuss the topics that matter to parents the most.
Welcome back to another episode of The Learning Curve. Onward we move, Rabbi Garfield, as we started.
Yeah, we're going through so many fascinating issues. It's amazing.
And today we're going to continue on a topic that we began last week, which was the role of therapy, the growing role of therapy, the very sensitive role of therapy that it plays and shouldn't play in the roles of our children. There's a very special guest today to continue on that theme. As always, we begin with the fireball emails. So here we go, Rabbi Garfield. Let's get right to it. Question number 1 goes from me to you. And just, of course, as a disclaimer, these emails were not written by us about our own children. They were sent in by our listeners. Some of them have names attached, some of them don't, but we'll keep them anonymous to protect the mothers and fathers. Dear TLC, my daughter has a real problem with honesty, and she really works on convincing herself that her fabricated version of the reality is the truth. My husband and I have such a hard time approaching it. We have tried lots of different approaches, and nothing seems to be working. Any advice? Doesn't say the age of the daughter, so I'll allow you to pick that lane. Problem with honesty, and she doesn't seem to ever see the truth.
So I have a funny take on honesty. It doesn't really fully apply to this case per se, but I'll say it and then I'll work it to this question, which is, sometimes I love when students lie to me. And I know that sounds right. You don't hear that. Yeah, please don't make that the quote on the...
on the Mishpacha ad. Sometimes I love when students lie to me. As long as the bubble is by your, coming out.
Exactly.
Wow.
Exactly. But I'll tell you why. Because I learned this early on. It's the child saying, I know what I did was wrong, essentially.
Oh, I've heard this from you. You told us in the first episode, Rabbi. Remember?
Did I? Okay.
Yes.
And then for our avid listeners,
you're going to tell me the shtickle of, so you mean, of course you wouldn't talk in class. Because if you're going to do that?
I wasn't going to go down that exact route, but yeah, that's the idea. It's basically a student saying...
Unpack it.
Yeah, it's basically a student or child saying, I know it was wrong of me to do X, Y, and Z, and I'm so embarrassed that I did it, that I've made up this lie. And as I probably mentioned in the first episode, because it's what I think about when I think about lying, we don't have to go far in Hashem's Torah to find people who are in denial or trying to avoid responsibility for acts they did that were wrong. So when you see a child being dishonest, you don't have to go far to look at some of the great personalities of our Torah to see that's a common reaction to being caught or being put in a position that you're in trouble. So I just want to put that out there, that being dishonest, even though, of course, emes is the chasima of HaKadosh Baruch Hu, and Bereshis Bara Elokim spells emes, and I'm not trying to minimize it. I think it's important to recognize that it's a human sort of natural reaction to shame. And let's focus on what's really going on and not on the end of the line is a lie, but what's underlying it? What caused it? What are the real reasons that child is acting out that way?
What's your advice for this parent?
Yeah, so what I was going to say is for this parent is that if the children are young, 7, 8 and younger, they do have this imaginary reality. And I didn't review the developmental literature to give like an exact analysis. Maybe we could ask our guests later on for that. But there is an appropriate stage where children live in a more fantasy world. They play in fantasy. They live in fantasy. The whole idea of a child playing peekaboo, right? They think you're gone. They have this alternative reality of truth sometimes. And so helping a child grow out of that is important. But I just mean to say that if a child is living in that and they're younger, that's not the end of the world. Now, how do you help a child move past that? I don't think it's on forcing them to admit that you're lying and I know it. I would think that there are softer ways to go about it, saying, okay, maybe that's true. But what are we going to do? There are no cookies left in the cookie jar. Or however we could avoid a non-confrontational focus. I don't think you
seventh grade. She's in seventh grade.
So that's already a bigger problem. Meaning if you have a seventh grader who definitely developmentally knows what lying is, that is concerning. And I imagine there are a lot of other things going on that need to be addressed. So that kid needs to perhaps be in therapy or be talking to someone or has other problems in their life. I guarantee you the only thing going on is not lying. And I would say to that parent, let's address some of those bigger issues and the lying will follow it.
You remind me of a story. It's not about lying, but it's similar. I had someone that I was close with, and his son stole his wallet. And then this boy was a high school kid, stole his father's wallet. And he says to his father, I want a computer, and I'm not giving you your wallet back until you buy me a computer. So the father calls me, and so what should I do? I knew the father was close to him, so I said to him, my initial reaction is call the cops. Don't let, this happened a long time ago, 10 years ago, when I was much younger. And I said, I can't let your son control you, like that's crazy. I said, but before I tell you to call the cops, I didn't mean it literally, but I meant to totally be tough on your son in that scenario. I have an uncle, Avi Fishoff, who deals with teens at risk. Let me call him. So I called my uncle, and my uncle says to me, tell the father to go to Best Buy and buy him the most expensive computer in the store. So I said, Avi, Tasbirli, explain this to me. Yeah. He said such an amazing word, exactly what you just said. He said, this is not a kid that is struggling with computers. There are plenty of kids that want technology, that want a computer. They don't steal their father's wallet. This is a kid that has deep issues, who needs real deep therapy and needs to unpack whatever is really hurting him. And this father has to show the kid that I care about what you care about and has to become on this kid's team and help him through whatever he's helping through. This is not a computer fight. This is a kid struggling with something much bigger. It was such a mind-opening moment for me. And I think when it comes to lying, it's similar. As you said, if the daughter is in boys 7th, 8th, 9th grade and he's pathological and he's lying and not saying the honesty, there's something much deeper there that needs to be probed as opposed to just, I know you're lying, tell the truth.
Agreed. All right, let me ask you a question now. You handled that very well. Here we go. Dear TLC, please walk me through an early stage vaping conversation with my son. Baruch Hashem, it's not an issue yet, but I hear it's prevalent in other classes and yeshivas, and I want to get ahead of the problem.
Vaping conversation with my son. So I have 3 teenage sons. I'll just share my wife and my approach. I hope my sons are the non-vaping.
If they weren't listening to the podcast yet, they'll be listening to this one. Hey guys,
they're in 2 different yeshivas, so it's not just one type of yeshiva, and all 3 of them are amazing.
Who's the best fisher of the 3? Is that even a thing?
Ozzy. Yeah, no, it's Pasha. My 9th grade son. Yeah.
Would anyone feel slighted by that question, or
no? They know.
Okay, no. Ozzy, keep it up, man.
Yes.
Fish that fish. Okay, go ahead.
So, anyways, you get me distracted. So, I think, of course, this is cultural. There are certain cultures where this is a real battle. I know yeshivish, non-yeshivish, of course. The more yeshivish schools, vaping is more of an issue. Our approach we try at our home is, I think when you try to convince kids not to vape because you tell them it's dangerous or you tell them this or tell them that, 9th, 10th, 8th, 7th, 11th graders don't think most things are dangerous. I had a Talmud of mine who just broke his leg, and the first question that the doctor asked him 2 weeks ago, do you vape? And he said, why do you care? He doesn't. He said, because the recovery process will be twice as long because it slows your blood flow to your ankle. He hurt his ankle. The recovery process will be twice as long for a 16-year-old kid. Interesting. But anyways, my point is that it's about, we're above that. I think the conversation about vaping is kids that vape because they think it's cool. No one vapes because it tastes good. Everyone knows it's bad for you. And you're not going to inundate them with studies. You could show them the horrible videos and some yeshivas do about smoking and vaping, what it does. But we're above that. We don't do that. In our family, we don't need to do things that other people might consider cool. Where in our line is, where Schonfelds don't vape. Pasnished. It's a pasnish conversation. For you, who's such a good boy, from such a good family, I think the peer pressure, the point is because vaping is a peer pressure conversation. So is drinking, so is vaping. And you have to give the self-confidence to your son that he doesn't need a vape to be cool. And adarabba, the kids that vape, there's nothing less cool I tell this to my Talmidim. I taught in Sifter for a bunch of years. There is nothing less cool than a kid trying to be cool. The kid that comes onto the basketball court matching his headband and his socks does not have the best three-point shot. And vaping is an attempt in certain circles to be cool. And we are bechefza cool in this family. You don't have to have the coolest family. I think the Schonfelds are pretty cool, but we're not the coolest, right? But we're proud of who we are, and we don't need it. It's almost you have to take it away from who you are. That's our approach. One of my children, I won't say which one, came home and let us know that someone in his yeshiva offered him a cigarette, I think it was a e-cig, whatever it was, and he turned it down, and he was very proud, and he was open with us. And obviously, having the open relationship and trusting is all important.
Wow.
And it's a hard sugya.
Amazing. It is. It's amazing how it's like slowly slipping further and younger. I was just somewhere, and I saw 12-year-olds or 11-year-olds in the Northeast like vaping. And I was like shocked that it's become such a part of the system. And it's so weird that it's like a frum thing almost.
Yeah, you could get very deep and maybe philosophical of how could it be that it seems the more right-wing you get, the more prevalent it is. Is it because they don't believe in Chachma B'Goyim Tamen, they don't trust the studies? Is it, of course, because they don't have so many outlets? There's a lot of, I'm not here, I don't think we're discussing why is it that causes this challenge. This is a parent that doesn't want a kid to have that challenge. And obviously, by the way, part of the issue is going to be who he's with, who his friends are, what yeshiva he goes to, what is your value system on certain yeshivas.
What's your camp policy on vaping for counselors and for students?
No, vaping is Yarkal Yaver. Vaping is Yarkal Yaver. Vaping, drinking.
You're because the Aish is the coolest camp. You don't need to.
Right. We're bechepza cool. No, and that's, I believe, again, 95% of camps have that, that policy. And a kid who's thriving in camp doesn't need the external high because he has it, hopefully, if he's happy in camp.
I hear you. No, definitely. It always goes back to this idea of what is the underlying cause, right? Like, why is he vaping? It's not because he has money to burn or the love.
He's vaping because he thinks it's cool. At a 7th, 8th, 9th grader, he's vaping or smoking or drinking alcohol. Doesn't taste good. No kid likes that beer or the schnapps. He's vaping because he thinks it's cool. And you have to show them that it's not.
Schonfeld, I'm curious, like as a manal or even in camp, but let's say go back to school scenario, if you find that like some older boys who are more exposed to it are bringing it into school and even exposing younger kids to it, like selling it or sharing it with younger kids, how would you handle that?
I've actually have dealt with that in the past in one of my experiences, and that is a red line. The general rule in chinuch is...
That means you will kill the child? Is that what you're saying?
I know, I have to explain what that word means. The general rule is that if a child is a machti, if you're causing others to sin, and if you're exposing children to cigarettes, to alcohol, to inappropriate material, that's where a yeshiva, a camp, has zero tolerance. Zero. I was involved in a scenario once as an educator, and there was zero tolerance. And that was that, for literally this exact case. That's where you have to show the kids that your achrayus is not to be mazik others. I think Yaakov Kamenetsky said, he's not Michael, the person who gave him his first cigarette.
Wow.
Yeah.
You might want to get that quote straight. That's a pretty serious quote.
Yeah, I think so. I know. I think so. I'm pretty confident. But yeah, these are tough sugyas.
Wonderful. Now we have a great honor to have one of the real leading lights in the mental health space to talk to us about these issues. I'll just briefly tell you all, the few people who don't know about Dr. Mandelman. Dr. Mandelman has degrees from Columbia, Yale. He did work at Cornell, close Talmud of Reb David Feinstein, Zecher Tzedek Livracha, Reb Nata Greenblatt, as well as Rebellia Brudny Shlita. And he does a lot of consultation for Hatzalah, Bikur Cholim, and other organizations, including Torah Masora's Acclaim, Diverse Learners Initiative, and Mashgiachim and Mechanecha's training program. And it's great to have you. You run the clinic, which is a mental health, I don't know exactly what it is. Maybe you'll tell us about the clinic, which is a place in Brooklyn. Where's the clinic located?
Brick, New Jersey, right outside of Lakewood.
And that's what you do now, right? That's your primary focus?
I don't know if I have a primary focus, but it is where I spend a lot of my time.
Got it. So what does the clinic do? And then I have a question for you.
It is a multi-specialty center where we have neuropsychology, social work, speech language, pharmacology, all under one roof.
Amazing. Amazing. Sounds great. And you work primarily with the frum community?
At this point, the vast majority of my patients are from the Orthodox community.
All right, so that's a great resource for us to discuss. Here's my question for you, Dr. Mandelman. I'm looking at your resume. I see Columbia, I see Yale, I see Cornell. Besides your proclivity to be involved in anti-Semitic institutions, why did you choose to go down the route of academic study? Why didn't you just get some therapy degree, become some kind of therapist, one of these specialized type of amigo therapy counselor, and put out a shingle and help for me in Lakewood? Why did you take this route that's so full of more complexity? Why didn't you just go the simple Yeshivish way?
Despite my appearance, I do not believe clinical and yeshiva should go in the same sentence. I am a firm believer in the need for there to be a level of excellence in clinical care, and I therefore pursued degrees and training in the institutions in this country, outside of whatever political stances they may have,
Right.
that offer the highest level of excellence, where excellence in whatever it is that one is doing is of paramount importance. And
do you find that the people around who are all over our community who have much less training do damage and are a problem for the community?
So I spent 12 years in graduate school, and again, at institutions that you previously have mentioned. Without appropriate education, training, supervision, when one is dealing with things as delicate as other humans' lives, by definition, they're going to be damage done. Not that everyone is maliciously intentioned. However, when it is that you don't know what you are doing, and you don't know your boundaries, and you don't know the scope of your work, and you are in a community which unfortunately is not as informed and educated within mental health as it should be, and as long as you are a co-religionist with something on your wall, people feel comfortable and people are desperate, and therefore they make decisions in terms of which clinicians they are going to use, not necessarily based on their background and expertise, but rather because of religious affinity as well as their availability. And a lot of them will espouse areas of expertise and specialty, which in reality is quite limited. That isn't to speak to all clinicians that happen to be Orthodox and practice within the Orthodox community, but there are many of them that do, that I would claim to be outright dangerous.
Wow.
Part of my motivation of opening the clinic is in order for the Orthodox community to understand that being Orthodox and expecting clinical excellence is not contradictory in any way, shape, or form. And in the same way that the Orthodox community, when it comes to medical care, will only pursue those with the greatest reputations and those who are the hardest to get into, and they will use whatever level of protection necessary, because they believe when it comes to something such as physical health, that's of paramount importance. Part of what the clinic does is being able to demonstrate we can have clinical excellence in mental health within the Orthodox community by and for the Orthodox community. And I end up, as part of my work, given that my focus is on diagnostics and consultation, unfortunately cleaning up many cases of clinicians who were not appropriately trained or supervised or educated, and therefore have misdiagnosed, mistreated, misguided. Again, I'm talking about their intent and talking about the outcome for the patient's experience.
How would you respond to one who says that there's a big difference between medical issues and the neshama of a human being? Psychology touches on the understanding of the basic psyche, the basic humanity of a person, and to go to the Goyim to understand that is inconsistent with our Messiah that represents a human being, a Yid, and the neshama at a different place in humanity.
First of all, there is no such Messiah. First, let's start with that. Second,
And a Yid is a different Metzias?
that what?
that a Yid has a different Metzias in the
Nida.
We all know the Kuzri. We all know how he gives Madrigish. We can go into Rabbi Yerucham, who adds Madrig of Ben Torah on top of it. We're familiar. We can deal with all of that. But when we're talking of, and I think a lot of what people's misconceptions are, is that when somebody has a psychiatric illness, or by definition, there is interplay with something religious. And then if you go to anyone, again, even from clinicians, there is a great danger that you are going to be negatively influenced and your soul is going to be damaged because of the vulnerability that's involved in the process.
And Freud's perception of humanity, which was kfira mamish.
So Baruch Hashem, Freud is dead. The field has evolved very significantly since then, and we are preoccupied with making sure that our practices are evidence-based. And I have the opportunity to collaborate on a constant basis with Gedolei Yisrael, and whenever there is a point of concern, I'm able to reach out to any of them and discuss whatever possible area of concern there is. And I can tell you that the Gedolim, just based on my patient load, have come to that understanding as well, that there is something called a psychiatric illness, which is in the domain of a mental health professional, and then there are ruchnistic inyanim that are within the domains of our great rabbinic leadership.
I just want to share a story that happened a few months ago. I was sitting at a Kiddush on a Shabbos, and there was a fellow, a very Orthodox fellow, who was saying this idea of Rabbi Garfield, that therapy is treif, and then like mamish, therapy is treif. Rabbi Bear would never let anyone go to therapy. And he said to me at the Kiddush, I went to Fallsburg, and he said to me at the Kiddush, $10,000 Rabbi Bear is against all therapists. So I was like, wow. Okay, I said, I think you're crazy. I left the Kiddush. I went Shabbos. I was eating Shabbos afternoon at his family. I said, over the story. The guy looks at me, and he says to me, who I was eating at, he says, I'm a Zivik Sheni, my second marriage. I went to Rabbi Eli Bear before my second marriage, and Rabbi Eli Bear said to me, get a therapist. And I said, a Yid? No, a good one. So I went back, mincha. It's a good thing it's machta like Kanye, you'd owe me a lot of money.
I can tell you that I learned B'chavrusa Rabbi Eli Bear's son, Ari, for 2 years. B'chavrusa. Rabbi Eli Bear has a daughter-in-law who's a mental health professional here in Lakewood, New Jersey, and that I am in regular contact with Rabbi Eli Bear about mental health cases that he refers and guides to appropriate mental health professionals.
Yeah, I think we're Baruch Hashem, we're all on the same page. Rabbi Garfield was just trying to poke the bear a little bit.
Exactly where he was going.
Yes, you know him well enough to know where he goes. Here's my shayla for you, Dr. Mandelman. As we're both Menalim, so we have parents that call us and say, how do I know when to be worried about my child? How do I know when it's just, he doesn't want to go to school, she doesn't want to go to school because she doesn't like school, or she's a little anxious, and it's the normal anxiety. And then when is there a barometer where a parent can, of course, we're stereotyping, and I understand. I picked anxiety, it could be OCD, it could be DHD, where we as Menalim should direct the parent to go get professional help. Is there a simply explainable mahalach to understanding the difference between normal chutzpah and normal jumpiness and normal anxiety for the first of yeshiva, of test taking, and when it turns into the area of, that's concerning, I think you should go for professional help?
So the paradigm that we generally use is, and again, even diagnostically, is really looking at the level of impact on functionality that it has and the level of pervasiveness that exists. All kids are going to be somewhat anxious before a test. But if a kid is not able to get out of bed that morning and for days before they haven't slept, and they will do anything under the sun to avoid it, and we are seeing negative behaviors as a result of it, that would be suggestive that this is not just garden variety test anxiety, which is a normative human response to it having to be able to perform at a specific level that has some stakes attached to it. But it really comes down to pervasiveness and level of impact on function. And this is a question that obviously we deal with on a constant basis. And what the interesting thing is, if you tell a parent that Baruch Hashem, your child is normal and they're developing and you need to give them time and space to do, they want a refund because they want letters attached to their name, because therefore it gives them an ability to identify, this is the issue, this is what's wrong. So no, your kid is a kid, if they're developing, this takes time. Give them the time and space, support them appropriately. And if you don't slap a diagnosis and a label on it, and if you tell them that this is normative developmental variation and that they just need to be able to grow into themselves, or really if the presentation is secondary to something else, if they would address the primary, the secondary would be less prominent. They don't know what to do with themselves.
What percentage of parents come in and that's your response? Do you find parents are being overly cautious?
I'll tell you the truth. The nature of my practice...
You're the last stop, not the first stop.
Exactly. The vast majority of people who are walking in my door have seen multiple mental health professionals, have had extensive testing. There's been previous treatment. Not all, but the vast majority. And they're coming because be'ezetam shatia, they have not been able to arrive at the level of clarity or care that they've been looking for until this point.
When it comes to a child like this struggling in a classroom, what can we expect from a Mora or a Rebbe in order to be supportive or to make it worse? Generally, do you find that teachers are trustworthy partners in addressing mental health issues, or do we have to approach them with more concern?
I don't think it's a question of trustworthy. It's a question of how informed they are. And like Rabbi Garfield said before, I'm involved in terms of Diverse Learners Initiative and Mashgiach Mechanechus program. And what is so important about that program is that we're able to allow people to gain the knowledge and understanding of what it is that they're actually looking at and what it is that's going on. So instead of it being a knee-jerk reaction as to this kid isn't behaving, therefore I'm going to do this, there you can give pause and think about what are the possible contributing factors that may be leading to this behavior or fueling this behavior or furthering this behavior. So it's not a question of trust as much as it is a question of how informed they are of whatever it is that's going on in front of them.
Have you found that our Moros and Rebbeim, again, we're being so stereotypical, but that's what we're doing, it's all we can do, are informed enough to help the struggling kid? I know it's Yeshivish, but is that a huge challenge, or is that something that there's been a lot of growth in?
There's been a huge shift of late where there is more understanding and a greater level of awareness, as opposed to them just thinking that there's something bad about the child. Is there still an enormous amount of room for improvement? Yes. But I think that a tremendous amount of credit goes to the Meistis, that even Meistis that we would not necessarily think of as being progressive in any way are very much the flagships and institutions of Chinuch have really stretched themselves beyond what they would normally be thought of to really understand and appreciate what it is. And a lot of that is an artifact of the reality of things not working. And I'll tell you, I'm nice. I got a call 2 weeks ago from a Rebbe. I happen to know the Manal didn't know he was reaching out. Nobody knew. He reached out and totally no information shared about who, what, when, where, and said, it's the end of the school year. I've been struggling with this kid. I've done every eitzah anyone's given me. Throw me a lifeline. I want this kid to be able to finish with a positive end of his year. I can't manage him in the classroom entirely. What can I do? And here's a Rebbe who is seasoned, accomplished, extremely well liked. But when he saw that none of the traditional methodology,
that's impressive,
the kid, he took the initiative to reach out and say, give me something. What am I missing? How does this make any sense? So again, there is no question more and more of that is happening. And again, when traditional methodologies and approaches are not being effective, it obviously is a significant motivating factor for them to be looking elsewhere.
A few years ago, I was bothered by something, but I think it's even changing now. which is I was so impressed that elementary schools had become places of more sophisticated training, mental health, special ed. And I felt like the yeshiva system, the high schools, didn't have that same level of sophistication. Like, how many high school yeshivas have resource rooms with properly trained professionals, or have mashgichim or mental health professionals who come and work with the kids? And I wonder if you see that changing even into the high school level.
I know that there's a movement now with Rabbi Elephant or Rabbi Budny. Maybe you're part of that, Dr. Mandelman, to train Manal. I got a phone call from a Siftis to try to, I think you're part of that, aren't you?
There is certainly a push now that there needs to be at all levels.
There has to be a buy-in from the top yeshivas.
And there is buy-in. And I can tell you, I am positioned in a way that I get to interact with all of the most competitive moistas in Klal Yisrael, with Rosh Hashivas that have me on speed dial, and institutions, again, that no one would think that this is a she. But no, there is more and more understanding and more push for them to get appropriate help, and not allowing it to sit until it's gone to a level where crisis, but identifying. And there are moistas, again, that would never be thought of as progressive, where there are conversations that are going on about mental health and people making sure they're getting appropriate interventions.
That's great.
Dr. Mandelman, as something that was always considered a red line for a yeshiva, you're never allowed to tell a parent that your kid needs medication, right? And we're not doctors, but we both, and I'll speak on behalf of myself, I've seen enough kids, Baruch Hashem. I run a camp. We spent one summer together. I think you were in Maganav, I was in Heller. And there are kids that I just know this kid needs to be medicated. I know his brother maybe, or I know him. I see it. He's ADHD. He's anxiety. The titles don't matter. And is that an appropriate, me as the manal, to have a frank conversation with a parent? You have the parents that are anti-meds. I don't mean the parents that they're the organic homeopathic. That's a much harder conversation. The taboo of medication. I don't like the way my son feels on medication. And me as the experienced manal, I know time after time that your son's life will change once he's medicated for whatever ADHD, anxiety, OCD, whatever it is. You're the professional. You're the doctor. Is that me overstepping my boundaries by trying to be almost overtly aggressive with parents in a loving? I'm not talking about parents that I'm close with.
I'll tell you where we get into trouble. We get into trouble when Menalim and Rebbeim and Rosh Hashivas believe that the beginning and end of everything is you take a pill and everything will be fine. Beyond that, parents very much feel when there is a mandate coming from the top, they feel very uncomfortable about it. And I think it all comes down to presentation. And when they're hearing it from the Menal, whose expertise is in chinuch, and they've seen many children benefit from it, if it's presented that they think this is an area that's worthwhile exploring, and this is something that I think needs further diagnostics and an evaluation, instead of it being the manal is telling me my kid needs meds,
right,
or telling me that my child is struggling, and there's possibly something that, if done through appropriate channels, would be helpful to leading my child to success.
The muscle that I like to use, and it's not my own, is the eyeglasses muscle of the kid who's struggling to read, and you move his desk, and then you realize he can't see. So the glasses is turning him back to what he is or she is be'etzem, and you're alleviating an unnecessary pain or struggle. And if we would view therapy, medicine as glasses to the apprehensive parent, that's my approach. Is the same way if I took off my glasses, I wouldn't be able to see the board. And that's the stigma that we try to erase. That Baruch Hashem, we've made tremendous strides in. But right, it's about the presentation and the not feeling that you're hassling.
Even within my clinical work, I will tell them my clinical recommendation is that pharmacology is something that would likely be very helpful here. And parents are, again, for a multitude of reasons, some far more legitimate than others, are apprehensive even hearing it from a clinician. But I make it very clear, I can only tell you what my clinical recommendation is based on 2,000 cases a year that I deal with. When you're not going to be, and sometimes they need to wait, and sometimes they need to start another process to see. And oftentimes, if, let's say, for example, a child presents with both an attentional deficit and a language disorder, I will tell the parents, clinically, that there's a clear indication for ADHD here. We have another issue, we can go start language therapy, and I'm just telling you that what we want is your child to be able to maximally benefit from whatever interventions are being offered. You can start that process, but in that process, if it becomes evident that they're not able to maximally benefit, given the fact that their attention is getting in the way, then it's incumbent. And again, there are some parents that I have to plead and tell them that your child without medication, you're doing an avla, and it all depends on the severity of the case and severity of what else is going on and the level of impact. We parents, and again, any responsible parent would be reticent and hesitant to go jump and do it. But when they're shepherded through that process and there's a level of transparency in terms of side effects, every single person believes that a kid on ADHD medicine is the same thing as having somebody on Thorazine, where they're going to be entirely sedated and drooling on themselves, as opposed to it being something that will aid in their ability to focus and therefore benefit them within the classroom. And again, lots of misinformation. Again, the vast majority of our population's information is coming from the school bus stop in the morning with other parents who share similar levels of concern. And even diagnostically, I will get all the time, in part of our intake process, we ask who suggested this diagnosis, and it will literally be from a friend, a neighbor, family member that heard something of a similar nature and therefore decided this is the direction that it should be going in. But again, there's a lot of misinformation about medication, including what side effects there are and how it will impact. And I tell parents all the time, the objective of the medication is to position your child to succeed. It is not to rob them of their personality. And if we're seeing drastic changes in who they are as human beings, it's a question of them being on the wrong medication or the wrong dosage. And it is an art more than it is a perfected science, but the benefits, when it is in fact called for, are enormous.
Rabbi Elephant was there from the Mir before Pesach, and he got up in front of a huge crowd of parents, and he said, the one piece of advice that I have for you is if your school or someone is suggesting medication, do it. Because he said kids are coming to him in the Mir, 3rd, 4th year base medrash, and they are missing this piece, and it like really starts to impact them significantly, which makes me think of people often say, my child starts with drugs in 6th grade, and what's going to be? It's like, what do you think are the risk factors for drugs if you don't help him succeed in 6th grade?
Ouch.
Yeah. What do you think is a bigger chance of someone ending up in drugs at 23 years old or 18? Is it a kid who was successful in school through medication and was really matzliach and goes on and is academically a success? Or a kid who can't pay attention, can't do well, and is constantly feeling bad about himself? Which is a bigger risk factor for medication?
And again, Rabbi Elephant and I are very close and constantly are in consultation with each other. But I see it play out, not only in Bismarck Bachram, I'll see it play out in Shalom Bayis. And I'll see it play out now, again, DSM, the latest guide in terms of diagnostics, is now much more permissive of adult diagnosis of ADHD, which is a recent change. And I'll get it all the time, and I'll get it in terms of parents bringing in their child. I obviously ask for a family history, and the wife invariably points to the husband and says, the ADHD, anxiety, language deficit, depression is all attributable to dad. And oftentimes there'll be a question of, and then the father will ask, is there something at this point in my life that I would still be able to benefit from?
Me and Rabbi Garfield have a hard time relating to such people. We're both docile, tame, calm.
No ADHD here.
And I tell everybody that I have done thousands and thousands of evaluations. I've yet to meet a person that has a shorter attention span than myself. I was once evaluating a child of a prominent mental health person, and the end of the evaluation, and that evaluation was pushed by one of the most premier Russian yeshiva because he was concerned that there was some component going on in a very competitive way. And at the end of the evaluation, the child tells his mother, whether or not I have ADHD, you'll find out soon. That Mandelman has ADHD, I can tell you now already.
I love it. I love it.
Yeah. Well,
let me
I heard
ask
from
you-
someone that if you take ADHD away, if you cure ADHD, who will be the rebbeim of our children? Yeah.
Let me ask you this. Assuming that someone's manal, a parent listening to this, has a manal, manaheles, that was not yet trained by DLI, the few that are still not trained by you in Torah Masorah through DLI or the Mechanchos training program, how does one assess if their educational leader that's giving them advice with regard to mental health issues knows what they're talking about or not? Maybe the person is ill-advised and giving them bad advice. Like, how does a parent assess their own educators?
So again, I'm not here to bash educators tonight. We could do that on a different night. But
Are you available?
I think it's also able to take that guidance and direction. Parents also very much feel like if they're given guidance and direction, they're stuck, they're mandated, sit with that information. There are, Baruch Hashem, enough from mental health professionals that they can bounce an idea off of. And again, anyone who's willing to make a diagnostic conclusion who isn't willing to be challenged and isn't willing for somebody else to look over their shoulder and say, does this make sense or not, is problematic. And I encourage every one of my clients to come in here to argue with me about the formulation. I want them to walk away with a level of clarity and a level of understanding as to why I arrived at what I arrived to. And again, with Manalim, Rebbeim, Morris, Manalis, whoever it is, if they're saying something and you then can go to somebody who you can trust that is more knowledgeable and better versed in mental health and bounce that off of them. And again, oftentimes parents are untrusting of their own gut. And because they're untrusting of their own gut, either they take whatever is said as gospel or they have to question everything.
Right.
As opposed to being able, and I do this multiple times a day, Mom, does this sit well with you? Does this make sense to you? How is it that you view this? Again, making them stakeholders within the process and making sure, and again, when we're in positions that we can make determinations, whether that be a manal or that be a clinician, we have to understand that there's a huge power dynamic at play. And people are coming to you, they're vulnerable by definition.
Yep.
And the fact that we hold the positions and the titles that we do introduces a very significant power dynamic. And people don't want to disappoint. They don't want to make you feel like they're not trusting of you. And therefore, they're put in a very difficult position as to, if it doesn't resonate, what do I do then? And I even challenge the kids. When I explain to them what I think is going on, I want it to sit well with them. I want them to be able to understand the process and where it manifests and why. So people also have to still know that despite there being power differential, they shouldn't lose their common sense or their parental intuition.
Right.
That's assuming that they're healthy, which is not always the case. But again, the more we can bring them into that process and the more we can educate them and empower them, the better our outcomes are.
Dr. Mandelman, I have one more question. I'm going to leave the micro and turn macro, maybe a little bit big picture, then hand it over to Rabbi Garfield, maybe to finish it off. But I'm not asking you to be a Navi, only a Chacham. And that is there a trend in the mental health? The children. Let's discuss the children. Is there a trend in terms of the biggest issue facing Klal Yisrael, the Frum Orthodox community today? And do you see it? Do you see a pattern? Do you see a trend? Is anything that you are concerned about? Anything that you see changing? If someone says, Dr. Mandelman, you get to speak at, I don't know what, the next Adira Torah event, and you get to speak for 5 minutes about the number one challenge facing the mental health of the chinuch of our children today, what's your answer?
Parent-child relationship.
Just to be clear, there's more listeners here than the Adira Torah event. But as if the Adira Torah is like a crowd. TLC podcast is where it's at. But anyway, continue. The parent-child relationship.
I think it all comes down to the parent-child relationship. And I am a developmental psychologist by training, and case after case, when it is that we see that there is a healthy relationship between the parent and the child, our outcomes, regardless of diagnosis, are exponentially better.
Wow.
From eating disorders to learning deficits, it all comes down to the basics. And we oftentimes get lost in all of the rest of the pieces, given lots of conflicting values and lots of things competing for our attention. At the end of the day, the single most important factor in outcomes of a child, with or without the diagnosis, is the relationship between parent and child.
Which part of the relationship?
The level of attachment, the level of understanding, that feeling of security. And again, regardless of diagnosis, because if I don't have, and I could just take you through my day today, eating disorder to a bipolar, to a child with a reading deficit, to a child with significant anxiety. And part of why, in my process, it's so important that we sit with the parents is we get to see those dynamics. I had a kid here who is struggling enormously academically. And I was asking him, are there any parts of school that you like, don't like? And immediately the kid fell apart. And watching how is it that parent goes ahead and tries to soothe that child? How is it connecting? How is it the parent is understanding that what it is that the child is going through is, and again, it's a game changer, and it is frightening the opposite. And how much of our children's anxiety is secondary to parental anxiety. And one of my associates is now doing their dissertation, really looking at the impact that parental anxiety has on their children in terms of their academic performance and their overall ability. Because think about, with all of the expectations and demands that exist, when parents are highly anxious and they're not able to regulate themselves, and they're not able to therefore give what they need to give, the children suffer. And then we end up projecting our own issues and shortcomings onto our children, which has very significant long-term negative impact.
I assume you've seen Rabbi Shlomo Halfman's kuntras called Kamayim, Upanim.
Yeah.
It's a masterpiece that talks about this. And really, like you said, he focuses on the relationship between parent and child as the key to all the other aspects. Really beautiful.
And again, regardless of diagnosis.
Yeah. He even says, even if the parent is not in the presence of the child, that they get those messages, which is almost Kabbalistic. It's pretty wild.
It doesn't have to be Kabbalistic. That's what attachment means. It means that I know and I have that sense of safety and security that there is somebody who is able to understand, appreciate, care, hold that which what I'm experiencing. It's not about physical proximity. And that's really, again, what is, in terms of, we look at risk and protective factors within developmental psychopathology, that early attachment is the keveya. And now we have a lot of cooks who are doing all sorts of reparative therapies for that attachment.
Right.
And again, a lot of what people are calling trauma and complex PTSD is really a manifestation of that lack of appropriate attachment and parental relationship early on. And parents also believe that if they can't actually just be real and own their own stuff and acknowledge their own shortcomings, they think...
You mean to their children or just in general?
No, in general as humans. But again, there's this sense that our ability to be there for our children is because we are the paragons of perfection. And if you share something with your child, feels like you're patronizing them in some way. I was here a few weeks ago with a colleague of mine who brought his child in, and the child was having a hard time in school. Again, it was thought to be ADHD. It was not ADHD. And the parent immediately connected with the child and said, listen, I had my experiences. But you saw that bond and messaged the parent afterwards. And I said, your ability to be fully present and connect with your child in the way that you were was awe-inspiring.
Wow.
Just that piece of being connected, being real, and the child having that sense that I am understood and appreciated for who and what I am, and that there's somebody who's not looking at my test score and not looking at my performance, but rather can understand and appreciate me as a human, is what sets people up long-term for their ability to succeed in life and be able to contend with real challenges, which are inevitable.
So I imagine our parents, along with this, are listening to this. Some are probably feeling good about their relationships, but others are either wondering, oh no, how do I do that? Or, oh no, I haven't done that. So what advice would you give to an aspiring parent who really wants to work on that relationship? Is there a protocol or a training or a safer? What would you give that advice so we could end off giving parents something that they could do to develop that key relationship with their children?
We are all aspiring parents. There is nobody who has perfected that craft, but it's really trying to be present despite all of the distractions that exist and despite any of the other things that we're contending with. When a kid knows that they are your top priority, irregardless of anything else, without any fancy techniques, without having to do any tachbulis to be able to accomplish that. When a child can understand and feel my mom or my father are able to be there for me in the moment and be present, which is enormously difficult. Being present is something that is a yikar metzias. But when they feel that they are priority and my parent is able to do that for me and recognize me, and it doesn't have to be these prolonged periods of time, and it doesn't have to be these over-the-top experiences, which are largely compensatory for the parents to be able to justify everything that they've done wrong until that point. And instead of just saying, I'm human, and sometimes I am not necessarily successful in the way that I want to be as a parent or as a human being in general, but just being present. And that presence alone allows them to really feel. And once they can start building on that connectivity, and again, people say, okay, you missed the critical developmental period, it's game over. No, there is a concept of repair. There is a concept of even later in life being able to give people what it is that they need to be able to move forward.
Dr. Mandelman, that was not only riveting, but inspiring. And really, we can't thank you enough for joining. And we know your schedule is busy being Isaac B'tzorchei Tzibur. And Kadosh Baruch Hu should give you the siyata d'shmaya, the health, and the strength to continue helping Klal Yisrael.
Chen Lamar.
Thank you.
There's a lot of takeaways, Rabbi Garfield, from Dr. Mandelman. To me, the most powerful was the ending. With all his, I don't want to use the words because I probably don't know it, all his clinical expertise and all his shemush and what he does the whole day, at the end of the day, it's about relationships. It's like that for our parents and our children. It's like that for our rebbeim to our talmidim. It's like that was Altan HaKadosh Baruch Hu, right? It's relationships are the bedrock of any healthy human being ability to function in this world. It was inspiring. Sounds gooky, but
it's like encouraging. It's empowering.
Yes. Empowering.
It's like we have the tools that we need.
We have it to be able to
whatever right in our hand.
He's a natural mitzuyin, or he or she has whatever the condition comes with it. If we're present, which is such a powerfully important word, for them, that will be the number one indicator of they'll be able to navigate their journey of life.
Right. I wonder, I'm sure it's based on research if he was so confident in it, and I'm sure there are some reports about it, but it would be a fascinating thing to look into and understand how that works, right?
Well, there is a therapy, LMFT. I have a family member who's a licensed marriage family therapist that her entire therapy is through the parent-child relationship. So there is an entire field in therapy that focuses on that relationship. And I
know Dr. David Pelkowitz, he's been quoting this for 20 years, this study, almost every speech, that the more times a week that parents eat together as a family is directly correlated to the lack of drug use as teenagers.
It's the same part. It's the same part.
Yeah, he's been quoting that for years.
Right.
Very powerful.
Right.
But just being present and just being an important figure in the child's life. So What a wonderful episode. I hope our listeners enjoyed it as much as we did.
Yep.
And we keep the TLC conversation going. We'd love to hear from you. We've heard from so many of you, and it really gives us chizuk and is very insightful. You have wonderful things to say. We could hear from you either through a call-in. The number to call in and leave a message is 443-686-9339. Again, the call-in number is 443-686-9339. Or you can send an email to thelearningcurve@mishpacha.com. Just spell it all out, thelearningcurve@mishpacha.com.
Rabbi Garfield, once again, it's a pleasure. Always is. Mitzvah Shem always will be. Take care.
All the best. Thank you for joining us on the Learning Curve podcast.
Find more on this and other topics at mishpacha.com.